Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can make use of it for your convenient continuous study. Anyway, we have been discussing about developmental delay and approach in pediatrics. Let us discuss the next case. Here we are taking two important cases. One is 5-year-old child and 7-year-old child. There are two siblings. There is difficulty in walking and tightness. There is in both the kids there is difficulty in walking and also there is tightness. And this was previously diagnosed as CP. Okay, 5-year and 7-year-old child. Okay, they are elder. It's not in the early part of the life. It's almost all 5 to 7-year-old. As far as CP is concerned, developmental delay is concerned, this is the elder age. Okay, so there is third degree consanguineous marriage. Okay, in both the kids this problem is there, and there is third degree consanguineous marriage. Okay, so perinatal period is uneventful. There is no problem in the perinatal period. Weight gain is also very good, and child is also cried immediately after birth. Now, according to the parents, child was absolutely fine up to 1.5 years of age. There is no problem at up to 1.5 years of the age. Then later onwards, parents noticed that there is a regression in the walking milestones after a minor illness. Child suffered from some fever and all, and following the fever, then there is a regression of the developmental milestones, especially walking. Previously, he was walking and running also. Now he is not able to run. Okay, now there is a tightening. Walking is also difficult. Of course, there is no seizures and there is no progressive tightening afterwards. There is no progressive tightening afterwards. That means during that minor illness, this tightening was started, and afterwards there is no, this tightening is not progressive. Okay, now two things are there. One, there is no seizure. One thing is there is no seizure means this is not a gray matter problem. Basically, this is a white matter problem. Okay, white matter is related to the tracts. Tracts means nerve supply to the muscles. Second, it is a progressive. There is no. There is a yes. Okay. History says that there is progressive tightening afterwards. Once the progression started, that's the tightening started after a minor illness. Thereafter, it is progressive. So what it suggests? Progressive means some disease process is still going on, and there may be some degenerative proceedings which is going on further. Okay. Therefore, it is a progressive. Anyway, we will look into that. Basically, the first physician diagnosed this case as CP. Okay, and the primary physician diagnosed this as case of CP because there is walking delay, and he has not asked this, not given much importance for this regression. Once achieved milestones, then decrease means it's the regression of the milestones. Regression of the milestones is usually seen in case of degenerative procedures, degenerative conditions. Let us see the next part. But in this case, the red flags and points are against CP. If you look into this case, the red flags and some of the other points against CP. What are the points which are against to CP in this case? Although that physician diagnosed this as CP. Number one is there is no risk factor in the perinatal period. There is no history of birth asphyxia. There is no history of periventricular hemorrhages. There is no history of meconium aspiration. There is no intrauterine infections. Okay, so that is perinatal period is totally healthy. Child is totally healthy. One. Number two, siblings are affected. Both the kids are affected. See, one is 5-year and another 7-year. Both the kids are affected. CP is not a the chromosomal problem. Okay, CP is because of the perinatal events which is basically occurring or some other damages. So siblings are affected. That gives concern towards some of the chromosomal issues or chromosomal problems. Then similar pattern. Both the kids show the similar pattern. Okay, in both the kids this happened after minor illness, that regression starts. In the second kid also, after a minor illness, the regression starts. And the tightening, which is actually the spasticity, that is progressive. That is degeneration is going on. Now, these four things are against CP. CP is one-time injury, and whatever the damage occur at one time, and later onwards there is no progressive involvement, because the definition of CP is non-progressive degenerative disorder. It is not a progressive one. It is a non-progressive. But here the history is suggestive of progressive disorder. And regression of the milestone occurring in a setting of consanguinity. Now here regression, so that regression is not seen in CP. Okay, जो भी इंजरी हुआ एक बार वो इंजरी हो गया और उसी का कॉन्सिक्वेंस है दैट विल गो ऑन uh, going on. Okay, there is no further progression or there is no regression and all. These scenes are not seen in scene is not seen in case of cerebral palsy. Now here what we have to understand is regression of the milestone is taking place. That is also in a setting of consanguinity. You know, third degree consanguineous marriage is there. Both the siblings are affected, and in both the siblings there is regression of the milestones after minor illness. So definitely this is not a CP. So we should not get confused with the CP in such conditions. So this is a neuron regression. Okay, so this is something is happening to the neurons. Neurons are undergoing regression or they are undergoing regeneration, rather degeneration. Therefore, this should be considered under the inborn errors of metabolism. May be the cause because both the siblings, consanguineous marriage, okay, similar type of the pattern. Okay, this may be an inborn error of metabolism running in the family, maybe like organized deficiency, okay, organized deficiency or some other metabolic problems. Okay, now what is the major message here is not all the developmental delay is cerebral palsy. Now, usually when you don't know the basics of this, we do a mistake that all the developmental delay, first thing which comes to our mind is CP. No, it's not like that. All the developmental delay is not CP. Now, cerebral palsy is motor impairment, global developmental delay. Okay, child is improving gradually and never worsen. History of the insult to the developing brain will be there. Positive MRI findings will be there. And there will be dominant spasticity on the examination. Condition is not CP when below findings are present. That means, so these are the basic nature of the CP. Now, if the below mentioned, what I am going to discuss now, if they are present, it is not considered as CP. For example, any condition with the progressive spasticity, bladder function and bowel symptoms, all are progressive. जो भी है जो progressive होगा वो CP नहीं है. CP में तो one time injury है. Okay, this is number one. Number two, persistent seizures, especially myoclonic seizures. If there is presence of the seizure, no, it is not CP. Okay, especially myoclonic seizure वगैरह है तो. Then no corroborating history and imaging finding. Okay, MRI and CT scan is not suggestive of such things. There is no cerebral atrophy or some this other damage, etc. Family history of unexplained death in setting of consanguinity. So it is not a chromosomal problem. It is not an inherited problem. Okay, so family history of unexplained death in a setting of consanguinity. That is not CP. Here also, in this case, what case we have discussed, it is not CP, it is because of the metabolic, inborn and metabolic problem. There is also developmental delay, but all the developmental delay is not CP. This is what I mean to say. Course phases, metabolic disorders, storage disorders may be the cause sometime. Multi-system involvement, vision, hearing, heart, etc. If it is there, that is also not CP. Basically in CP we have got motor system involvement, especially gross motor, if it is spastic cerebral palsy. So these points helps to differentiate the developmental delay of CP origin and developmental delay of other origins. The next class, so we will discuss about the management of developmental delay in detail. Thank you very much. Don't forget to subscribe to my channel and also please give your valuable